Espero que algún día la ley esta se lleve a cabo.
I hope one day this proposal and medical interpreters, we can have them available.
Gracias. Muchas gracias.
Muchas gracias.
Thank you. I'm going to move to take the roll, and then we'll move on to issue 2. Madam Clerk, would you please call the roll?
Thurman,
Here.
Bonta, Chu, Grove, Harper.
We're moving on to issue number 2, California Medicaid Management Information System Spring Finance Letter. We call forward Karen Johnson from the Department of Healthcare Services. We're here from Finance, the LEO's office, and public comment.
Good afternoon.
We're ready.
Karen Johnson, Chief Deputy Director, Department of Healthcare Services.
Welcome.
Thank you. In May of 2010, DHCS Healthcare Services awarded the California Medicaid Management Information System to ACS State Healthcare, which then later transitioned to Xerox State Healthcare to provide maintenance and operations and services and to replace the operating legacy KEMA system. It's a system that is over 90 different applications, well over 7 different computer languages. In October of 2011, we successfully completed that transition, and I'm proud to say that we have processed well over 236 consecutive check writes since October of 2011, and we've issued over $100 billion in terms of payments to our fee-for-service providers. In October of 2012, DHCS began the system replacement activities. Release 1 was successfully implemented in December of 2004, with the remaining releases to be scheduled in 2015 and 2016. With overall completion by June of 2016. In October of 2015, Xerox announced that they would most unlikely not finish the replacement projects in California and Montana. As such, DHCS has entered into a settlement agreement. The resource request that is in front of you today is to fund 24 positions to complete the following activities: conduct closeout activities for Xerox portion of SR system replacement activities, including legacy system development notices that were deferred and identifying any salvageable assets, procurement and new contracts to support business operations, and to reevaluate our approach to replace the legacy system under the new system replacement efforts. So there's 3 questions. I would like to go into each one of those questions that are in front of you. So what are the lessons learned from the state from the experience with this contract? So first, strong contract management was essential. The management of a large-scale IT project requires staff to remain on top of the day-to-day activities. The KEMA's contract was over 1,100 pages, with the vendor's narrative technical, which was about 11,000 pages of technical and business processes to this. So staff were responsible for learning both documents in order to provide adequate oversight. One of the critical lessons that was learned to be more agile in terms of the project design, scale, and timing. The vast majority of IT projects have suffered long delays where a project was broadly scoped with a goal to deliver functionality many, many, many years later. This massive, slow-paced projects are not keeping pace with the rapid development and changes in information technology. Now, the federal government, Centers for Medicaid and Medicare Services, as well as the Department of Healthcare Services, all recognize and endorse and have implemented changes to create smaller, modular projects that deliver functionality to shorter periods of time. The new CAMIS, California Medicaid Management Information System Replacement Project, will utilize this modular approach. In what ways did the state manage this contract well? Contract management and accountability positioned the state in a strong, favorable manner when it came to the contract negotiations. The department paid out $9.9 million to the vendor and received and tested and implemented a single sign-on product in exchange, as well as the base code to integrate new products within our legacy system. Plus, we also received $103.3 million in cash and $15 million in hardware software. Governance was set up early in the contract period, and we established multiple points of accountability from executive, administrative, and technical teams. All of the decisions, formal communications between parties were well documented, and therefore expectations were clear. This meant that the shift to Agile, as well as the detailed implementation metrics, allowed DHCS to measure performance. We also trained our project management staff and project management principals with the Agile methodology for software development. This created a well-educated workforce at all levels that could be recognize the issues before they became problems. And the third question is to please describe the new modular approach that DHCS intends to pursue on a go-forward basis. So CMS issued notice to the states with the intent of this modular approach and the design, development, and installation enhancement of the Medicaid eligibility enrollment systems. This modular approach refers to developing software applications in terms of modulars of components. A modular system kind of breaks up into much smaller and manageable sub-components that are separately designed and developed. With modules, multiple smaller vendors can bid on shorter-term projects of smaller size and complexity. The Department of Healthcare Services has already implemented portions of an enrollment module, which is known as the Provider Application and Validation Enrollment. Feedback from the provider community and other stakeholders regarding PAVE solution has been overwhelmingly positive. I'll pause there and take any questions.
Thank you, Ms. Johnson. Mr. Chu.
Could I ask if there's anyone here from the Department of Technology? Okay. What I wanted to ask is I have sat through too many hearings learning about yet another major IT project that became an implementation disaster. And I want to get a sense of how many projects have there been around the state. We keep hearing about more and more, and I know this is just one project within your bailiwick, but there is clearly a pattern of the state's inability to manage major projects like this, multi-year projects that turn out to be a train wreck that waste millions of dollars that should be going to serving the very folks whose department you represent. Billions. So I would like to make a request, and I do hope if the Department of Technology is not here, they're listening, and we'll certainly let them know. But I'd like to get an inventory of all of the projects around the state, particularly that impact this subcommittee's Health and Human Service area, but around the state that have not resulted in success, because clearly there's not oversight that's happening either in the executive branch or the legislative branch. I know these are pretty tough words, but we've just sat through too many of these hearings and seen millions and millions, if not billions of dollars being wasted that should be going to our constituents directly rather than going to IT vendors who tell us after a couple of years that they can't finish a project, and then to lawyers and contract folks that try to negotiate coming out of that project, and then to new consultants telling us how we're going to do the project differently. So if I could request that, certainly with your department, but if you could pass that request on to the Department of Technology. It baffles me that we don't have accountability on this, and I, for one, would like to see more.
Ms. Johnson.
We can definitely work with the California Department of Technology to provide that, but specifically on this project, we started with the transition of the legacy system back in 2010 and then successfully did the takeover and turnover. It took us about 18 months, and we were able to transition to a new vendor in October of 2011. And then we have had, some changes that we have implemented that have been successful. With our legacy system specifically related to ICD-10. And then in terms of the system replacement activities, we didn't start until October of 2012, and we did have a release that was able to be stood up. It was just the releases that were coming, release 2, 3, and 4 during 2015, 2016 that we were not able to stand up. And as such, the department did, compensate the vendor for only the deliverables that were provided, and that was specifically related to business rules extraction as well as to Release 1. And so out of the $179 million budget that was allocated to Xerox for this particular project, we only paid $9 million. And then part of the settlement negotiations and the agreement, we were able to secure reimbursement of all of those costs. So we were able to secure the costs as well as the federal government FFP portion of those costs.
And I very much appreciate, and I'm glad that we didn't burn the entire amount. I guess my question is, how do we end up entering into a $180 million contract with what should be one of the top companies in the world and somehow see that project fail? And I know you have many things under your responsibility, so there are many folks who probably can help better answer this question, but inquiry minds would like to know.
Okay, thank you.
Thank you.
Thank you. Did you have anything else that you were going to add in your remarks?
No, I did not.
Thank you. Can we hear from Finance?
Yeah. Jamie Montalka, Department of Finance. We'll go back with California Department of Technology and see what we could get for you as far as a listing of projects and see what they've got.
Do you have any sense? I have to imagine that your department has been concerned about the number of major IT projects that fail.
We do have a internal technology unit that oversees and works with the California Department of Technology, so we could probably get some information.
Do you have any sense? The chairman suggests billions of dollars. That would be my guess too. Do you have any sense of a dollar amount of how many of these projects have failed?
Not.
Okay. Just 2 weeks ago, I think we heard from Department of Social Services about a $500 million project involving records of child welfare caseloads, and again, very, very distressing.
LAO from the Department of LAO's office, anything additional on this proposal?
Let me ask, has the LAO ever done an analysis of all these projects that have failed across departments?
Lourdes Morales with the Legislative Analyst Office. We have not done a holistic evaluation of IT projects. As some have come forward to the legislature, we've done kind of individual assessments and then look at what some of the issues would be and made recommendations on path forwards. Just to give you a sense, though, in terms of the question you asked previously, just as a rough order of magnitude, currently there are about 40 state reportable IT projects in the works, and the total value of that IT portfolio is about the $4 billion range. And so all of these projects are currently in development, so we don't know whether they've been successful or whether they will ultimately be in use, but that's just the scale of what's in progress.
So $4 billion, big number, and we don't have a sense at this moment. There's no dashboard where someone in state government can tell us probability of success of the 40 projects?
The Department of Technology does maintain a website that does provide a dashboard and does a stoplight evaluation, whether a project is red, green, or yellow.
Okay. If you could forward to us at least, I know I keep feeling like I see audits from the LAO every few months of failed IT projects. If you're able to just put them all together of what your LAO has done in this area, I'd love to just get a sense of what the big picture is.
Happy to help with that.
Thank you.
Thank you, Mr. Chua. The reason I say billions is because I know that we have this conversation in both the health and in the human services space. Mm-hmm. In my short time around government, including in local government, I have heard countless times that we have systems that just don't work. Mm-hmm. And we do changeovers, and we do crossovers, and we do over, and we do a do-over, and we just struggle. And so I feel pretty confident that the number is in the billions. Just given what I've heard from both the health side of the equation and the human services side of the equation. Mm-hmm. And so I appreciate the offer to work through the Department of Finance and the analysis and the review that has been done and to see what you can put together. I'm going to ask, just like I did in the last panel, that if there can be something in writing provided to the members of this committee within a week, whatever is available, that will be important. Because, again, the members of this committee will be asked to make decisions about this proposal and several others in the technology space, many that we will hear in just a few minutes. And I want the members of this committee to be as informed as they can about what we've done well and what we haven't done well, and to be able to get their questions answered around accountability. So I appreciate the offer. Anything else that you want to add in regard to? I'm asking for a summation in a week.
No, yeah, we'll go back and we'll see what we can get for you guys as soon as possible.
Thank you. Any public comment on this item? Any public comment? Mr. Chu.
If I could just make two more framing comments. We sit in a lot of these hearings, and obviously this is starting to pique our interest. These are not the issues that I think excite a lot of members of the public, but the amount of money we're talking about and the amount of potential waste that we're talking about, I think should. And if we're talking about $4 billion worth of projects, that's larger than the projected surplus for the state of California this coming year. That is larger than many departments. So very much appreciate any analysis. And I do know you obviously could probably tell this is something I've been thinking quite a bit about. I do know many of you sitting around the table, you're not individually responsible for it, but I think as a state government, there is someone or someones who are significantly dropping the ball. So I'd like to get some answers, and I appreciate that.
As Assembly Member Chu was providing his framing, I'm always struck by we're in the state with the greatest technology capabilities anywhere, really. And for those of us who live in the Bay Area with such proximity to Silicon Valley, it baffles me that we cannot get these systems to work that allow us to better serve those in the health and human services space. And I'm sure the same is true in education. When you look at the subject of tracking, attendance and when children transfer across districts. And so it baffles me that we've been unsuccessful. So I'm hopeful that Mr. Chu is going to bring a bill that's going to help us to move forward on this. I'll be ready to sign on. But in the meantime, keep asking the question, and we'll keep asking the question. We'll keep asking the questions in the space that this committee has some purview over, and that is within health and human services. We appreciate what you shared today. We appreciate you being a part of this ongoing conversation that we've just started. And I know that we have someone here from the Office of Systems Integration. We certainly welcome your adding on to this conversation when you come forward to make your presentation. Thank you so much for your presentation. Thank you. We're going to move on to issue number 3, Medi-Cal Eligibility Data System Modernization, OSI Budget Change Proposal. We call forward Cynthia Tosher from the Director of the Office of Systems Integration. We'll hear from Finance and the LAO's office and public comment. Welcome. We welcome your presentation. I gather that you picked up from the tenor of our previous panel and conversation where some of the interests lie in this committee. We certainly welcome you addressing what you can, and we look forward to hearing your proposal. We're ready whenever you are.
Excellent. Mr. Chair, members, my name is Cynthia Talker, and I'm the Deputy Director of Office of Systems Integration. I wanted to say thank you for inviting me here today. And I wanted to first let you know that the agenda laid out the issue very well. This is a proposal for planning efforts for the system replacement of MEDS. MEDS supports programmatic functions for eligibility, enrollment, and reporting specific to Medi-Cal beneficiaries, and also supports a number of other programs as well, like CalWORKS. It's used by the counties, and the data interacts with CalHER's healthcare, so it's a very important system that is currently being used. The system is about 30 years old, so it's outdated technology, and the goal of this is to determine where we're going to take MEDS in the future. So to spend some time planning with a multi-departmental initiative to understand what the scope should be, how we can best share services, et cetera, and so to determine how we move forward. With that, I can move into the questions, or, okay. So your first question was, please describe how the OSI proposes to structure the planning process in order to ensure a successful procurement process and replacement system. And so we've structured the planning process to include an executive governance structure, visioning sessions, and alternatives analysis. So the first thing is that with the executive governance structure, it includes both of our project sponsors, which is the Department of Healthcare Services, the Department of Social Services, and then key stakeholders, including SAWS systems, CalHERE systems, and the County Welfare Directors Association. So representatives from all of those groups are a part of our tiered governance structure to assist the core team in completing the planning efforts, helping to provide direction, et cetera. With regards to visioning, we had held visioning sessions to bring all of those people together to come up with a single vision of how we were going to start moving forward in our planning efforts, what was important, et cetera, and also to provide a framework for the prioritization and decision-making needs that are going to be occurring when we start looking at our alternatives. We have an alternatives analysis vendor that we are about to begin procuring. That vendor will be coming forward and then helping us to identify scope, identify opportunities for shared services. We don't want to just necessarily assume that MEDS is going to be copied exactly how it is. We want to think across agency-wide and how best to implement. With regards to question 2, with any large IT project, how does the OSI maximize the benefit to the state of being California, home at Silicon Valley? I think for OSI, we procure, manage, and deliver complex technology systems. And so we try to maximize the benefit by implementing governance models that engage stakeholders, ensure strategic alignment with agency-wide, Health and Human Services agency-wide strategies, and try to support effective coordination of communication, collaboration, and decision-making amongst the stakeholders. We also identify and pursue shared services, like we were saying before, and try to help the agency maximize investments across the departments. And then last, we do try to keep a look on what the industry trends are and best practices and identify where we can best adopt those to continue to have improvement with the processes as we manage these large IT projects.
Thank you. Any committee questions?
I want to just drill down on one part of the committee analysis where DHCS said that in supporting the system on outdated technology with a declining workforce of those skilled in technology has created significant risk to the department and its partners. We all know this is a very standard thing that's happening in state government. So we put a system in 20, 30, 40 years ago. That system over time becomes outdated, and we have to move to a new system. The folks that helped us implement and run that system are aging. Many of them are actually literally retiring from state government. And so not only are we losing the expertise on the legacy system, but we don't have new folks that are trying to think of what we need to do to upgrade. What sort of lessons have you learned to address this? And, I'm thinking about this again more holistically because I keep hearing this as a consistent theme across many departments.
I can't speak necessarily to the department's concerns with regards to their concerns internally. They currently manage, maintain, and operate MEDS. I do know that MEDS, especially on the outdated technology, when you're looking at the interoperability, interconnectivity that you're looking for across different systems in order to best communicate data, information for consumers, constituents, et cetera, that the older technologies, it's very difficult to support. And so without doing a modernization of some sort to MEDS, then it becomes more and more difficult for MEDS to be able to interact with new systems as they come on board. I don't know if you have anything to add.
Hello, again, Renee Malo, a Deputy Director with the Department of Healthcare Services. You know, in looking at MEDS and the work that it does for the department and the services that it provides, because it serves as our data repository for Medi-Cal eligibility, also for individuals that are under CalWORKS and CalFresh and for the WIC program. So, you know, as we're looking at this system and the changes that are needed, we're really, you know, working to rely on Office of Systems Integration and kind of their perspective in managing these large IT projects. And for us to recognize that we have to move towards a new structure in terms of the systems that we manage and operate. Because of the programming that the system was built upon, yes, the staff are aging out. yes, the technology is very old, and our goal in terms of the work that we had done on the visioning was looking at how do we restructure this system so that as we move forward, that it can be more nimble, more flexible in terms of the changes. Because the system has not been overhauled in such a long time, it's going to take time in terms of us thinking through what is the most appropriate solution for us in terms of managing the programs and the services that we have to operate. The thing that we recognize about meds is its stability. Even though the technology is very old, the system only goes down 2 hours a night. And so we recognize that stability, but in terms of our ability to move forward with the times and technology and doing business in a different way to meet our respective program needs, we really need to look at a way in which this system can be more modernized. And so we recognize that. We just don't have the staff infrastructure to keep making the changes to meds that we have done in the past because it's an old technology that's no longer supported. So that's why we're looking for the resources that we need in terms of supporting this proposal.
And I think my perspective on hearing what you're saying is I feel like I have many conversations just like this with heads of agencies who are all experiencing the same thing, siloized in different departments. And again, I sort of look to the Department of Finance, Department of Technology to think about the issue of legacy systems exists everywhere. So how are we as a state government working across silos, trying to grapple with these challenges? I assume that because these are legacy systems, there probably aren't even a lot of, say, software updates or other upgrades, which could put us in a few years in a very bad place.
That's correct.
And I think one of the pieces of this planning effort, especially with multi-departments and multi-programs and the amazing number of people or systems that interact with this data, it's one of the reasons why with the sponsors coming together to take a look and really determine, is there a service somewhere in the agency that rather than recreating it again, I don't know, identity management, can we use a service that's over here at this department they've already created so we can start sharing across rather than in the past where you've built everything in that siloed form. So really taking the time to plan across the agency and determine what the best go-forward path is for the system.
Great, thank you.
Just to pick up there, is there a discussion about how to build sort of towards the future? Is there a strategic plan as it relates to technology in these areas? I heard you both refer to many programs, CalFresh, CalHears, Meds. I, for one, will put in a vote for different branding on that name, but that's just me. Is there a conversation? If I were sitting where you were, I'd feel like, wow, they're asking us to change these systems that are 30 years old. We don't have a lot of resources. I'd be saying, hey, fund this proposal and help us strategically think about the future, about where technology is going to go in the future as it relates to all of these programs. I'd be saying we're not going to do this in a piecemeal way or a one-off way. I'd be saying, yes, give us this proposal, these dollars, and we're going to help build a strategic plan for how we build the infrastructure that will help us serve the Californians in health and human services. Are those kind of conversations going on right now?
Yes, sir, they are.
Tell us a little bit about that.
I personally am not at the agency level, but we do have a strategic plan that the Health and Human Service Agency has provided in talking about the same things. What's the infrastructure, better use of resources, whether it be technological, whether they be skill sets of human beings, et cetera. And I think it's also one of the reasons why with the meds modernization, having it be multi-departmental, it's not just OSI working with DHCS. Is really looking at the broader perspectives of the people that have to use the system to try to get that more global or that larger concept, and to determine the scope, because with it being that larger concept doesn't mean you can do everything at once, but what is that go-forward path? So I believe that the meds modernization is grounded in what you're asking about. With regards to specific conversations, I would have to refer or go back and get that information for you.
Thank you. Let them know we've been asking and that we hear the need for these specific modernizations, but we're asking about the big picture as well. Thank you.
Yes, yes,
Oh,
ma'am.
and just to add to that, so part of, the strategy in terms of working with OSI also serves as that project lead for both CalHERS as well as the county eligibility systems. So that's really looking at what that infrastructure is for insurance affordability programs here in the state of California. And as we're looking at those systems, looking at the needs that we have, the changes that we have with those system infrastructures, we're also looking at ways in which we can leverage enhanced federal funding from the Medicaid program and how that enhanced funding can also be used to support changes that may be needed to support, say, our CalWorks program or our CalFresh program. So we're looking at that from that perspective because we have to meet a certain level of maturity in terms of these eligibility and enrollment systems. And so we're leveraging the expertise that comes with OSI in terms of overseeing those projects. And the department sponsors are working more collaboratively than what I could say they have in the past in terms of working together, not only as state agencies, but also with our county partners and looking at the needs that we have for these programs and how these systems can help with the work that we have to do in terms of effectuating coverage for the populations that we serve here in the state of California.
Thank you. Let's hear from finance. Anything from the LEO's office? Any public comment?
Linda Way with Western Center on Law and Poverty. MEDS is a critical system and needs to be modernized. Thanks.
Thank you. We just got confirmation that we need to do more. Thank you. Thank you for your presentation. Thank you. Issue number 4, thank you. Medi-Cal eligibility systems, DHCS budget change proposal. We welcome back Ms. Johnson as well as Ms. Mallow, and we'll hear from Finance and LAO's office and public comment.
Okay, thank you so much. So again, the proposal that's on the table right now is a request for funding for 4 permanent positions. We're looking at doing some contract conversion for these positions to be established as permanent, as well as to continue funding for 7 limited-term positions for a total of, in looking at the proposal for the limited-term positions as well as the 4 permanent positions for a total of 20 positions that we're looking for funding and support for. So again, this funding and support will be for work that will be undertaken within the Department of Healthcare Services, both in terms of our Medi-Cal eligibility division as well as our Enterprise Innovative Technology Services division. And these staff have the responsibility for doing both the policy work and regulations development as it relates to requirements under the ACA and the Assembly Bill 1X. ABX11, as well as the technical support and development that the IT team has to do in terms of making changes to MEDS and then making sure that some of the changes that has to be undertaken by MEDS and interfaces that are needed, that those things are carried out appropriately with the appropriate staff. And I don't know if Barney, if you'd like to add anything.